Okay, I want to thank everyone for joining us. Good afternoon. Just on behalf of Northwood, I want to thank you for joining us at today's press conference. My name is Tara Wickwire, and I'm the moderator for today. We have about 30 minutes, and with me, I have Janet Sim, who is CEO of Northwood, and Josie Ryan, who's the Executive Director of Long-Term Care at Northwood. We're going to get an overview and some opening remarks from Janet to begin. And then we will move into the Q&A portion of the press conference. So the mechanism for asking questions is if you go to the Q&A box at the bottom of your screen, and if you can put in your name and your outlet and the question that you have, I will then be posing those questions to Janet and Josie. So I will now hand it over to Janet to take it from here.
Thank you so much. Good afternoon, everyone, and thank you for joining us today. This has been a tragic time in our province for so many ways that we cannot even fathom. Our hearts go out to those families that lost loved ones yesterday. As residents of the Portapique community and all Nova Scotians cope in the aftermath of Saturday's tragic shootings, I want our Northwood employees and community to know that we're here to support you. I'm Janet Sim, President and CEO of Northwood. We're here to update you on our current situation at Northwood and the safety measures we have in place to protect our residents against COVID-19. We'll provide you with an update on the emergency plan activation and the steps we're taking to isolate the virus and continue to provide quality of care. We'll also address the concerns from Northwood families and our outline of resources that are available to help us fight this disease. I'd like to express my sincere condolences to families of those residents who recently died from COVID-19 or other complications. You're in our thoughts, and we'll continue to support you during this very, very difficult time. I want to sincerely thank our hardworking employees, and we understand that you are afraid. You're demonstrating so much courage and leadership, a true commitment to our residents. You're our heroes. We're so grateful for your efforts every day to take care of our residents. We also need to thank our healthcare partners that have stepped up and are lending a hand. The Nova Scotia Health Authority, Shanax, VON, EHS, so many people who are supporting us in this response. We truly appreciate this effort. We want to provide you some specifics with respect to Northwood. Some of you may have noticed that we are now updating how we're reporting on COVID information on our website. We will continue to update on the number of positive cases, recoveries, and those COVID-19 related deaths. We'll do this following the provincial government updates to avoid confusion with reporting. For our daily update, we are reporting today as follows. We have 151 total facility cases, which is 36 new cases. In that total include 111 resident impacts, which are 31 over our previous reporting. Staff cases, 40, which is an additional 5 over our previous reporting. Deaths, as you're all aware, we've had 5 unfortunate deaths here, and we have no new deaths to report. Recoveries, this is where we need to celebrate. We now have 1 individual in our recovery unit, and we're told she's doing fine and is being treated like a queen. We have 2 more individuals approved to be moved to the recovery unit in our off-site location, and we're building up our restorative care to be able to assist these individuals to recover in a way that is comprehensive. We have geriatric care, we have physio OT, and a tremendous staff on site to be able to support that. We have a number of additional residents that will be moving over in the next couple of days, and we are, at this point in time, we're waiting for the final confirmation, but we expect that by Friday we'll have 8 additional individuals moving to the recovery unit. We also have a number of residents that have come through this and are no longer symptomatic. We are very cautious in this approach because we do have guidelines that we using with respect to public health in terms of that official determination of recovery. We'll continue to provide those updates in the days and weeks ahead. Our emergency plan. With the number of staff off and the growth in the number of cases that we've had to reach out. We're not able to manage this on our own. We were doing very, very well up until the last couple of days. So with the activation of an emergency operations center at Northwood, we have increased our resources in the fight against COVID-19. Staff from the Nova Scotia Health Authority, the Department of Health and Wellness are on site at Northwood to support our response. A COVID-19 recovery unit, as mentioned, has been established at a local hotel to care for recovered residents, and they're being treated like royalty. We have received equipment from Shanex for our recovery unit, including electric beds, tables, and other supplies. And donations continue to come in from various areas in the province, and we're so thankful for that kind of community response and support. We're grateful to the support from so many organizations. As I mentioned, the Nova Scotia Health Authority, we've got students coming forward, GEM and Rosecrest in the supply of masks, Victorian Order of Nurses, Red Cross, EHS, and other government staff and staff from other facilities that continue to come forward to help us in this response. Resources from the Halifax Infirmary COVID-19 unit have also been deployed to Northwood to treat COVID-19 positive residents on site. We're so appreciative of their expertise and their support. We have increased our testing, and that's actually happening on site with additional resources that have come forward. We can continue to focus our efforts and our support and Northwood's resources on the important work that we do every day, the care and support of residents here at Northwood. Sadly, no one is immune to COVID-19, and at Northwood, we're caring for our vulnerable population. We're doing everything possible for our residents. I can tell you that our staff is absolutely incredible. They are truly our healthcare heroes on the front line of this response. Every day they bring love, caring, and warmth to every single one of our residents, and they are doing this while they are beyond exhausted and missing their own families. This is a time for understanding. This is a time for compassion, and I want our Northwood families to know we will continue to do everything we can to care for your loved ones. I know how difficult this is, not being able to be with your loved one, not having the answers that you need. We thank you and appreciate your patience. We must continue to be vigilant and work together. We have added additional resources to support our regular outreach to our resident families. We understand that what we've been doing has not been enough. We want to increase that communication so that you have information on your loved one. We want to be there to support you and your loved ones through this challenging time. We'll be contacting families with updates about our residents on a more regular basis, not just weekly. We have also created a new email address where family members can send their questions. northwood@nshealth.ca. We'll make sure this information is available on our website. Now, myself and Josie Ryan, our Executive Director of Long-Term Care, are open to questions.
Thank you, Janet. So I did receive a question. The first one, this is from Jennifer Henderson at the Halifax Examiner, and I know we mentioned these numbers, but maybe we'll just go back to them. She's asking how many positive residents and staff are COVID positive at the Halifax campus as of today.
I can start, and Josie can certainly follow up, but the information that I have given you regarding our positive cases and number of staff, this is all involving our Halifax campus. Our Bedford campus has not been engaged in this battle.
Okay.
So I can give a little bit of the process on how we, so every day we do swabs if anybody's symptomatic, etc. And we also are now doing swabs on all residents and all staff who haven't been swabbed. So what you'll see is you may see an increase in cases in the next couple of days because we are swabbing everyone. What we're seeing with this virus is that some people are asymptomatic but are still carrying it. Some people have minimal symptoms, can have one of a number of symptoms. So we've decided, working with the medical officer of health, to just swab the entire building, and starting with the floors that aren't affected and going to the other floors.
Great, thank you. That was actually the only question that I have received. Oh, there's another one. Okay, from Alicia Draus at Global. So hearing about two sets of rules for renters, rental tenants, and for long-term care residents. that the long-term care residents are in lockdown, whereas the tenants are moving about, and that renters can have a designated outside person to bring them items. Can you confirm sort of the details around that, if you don't mind?
Certainly, I can start. And the Halifax campus, we are comprised of 4 buildings, and 2 of those are completely tenant population. One is not connected, and the other, our tower building, basically that has been shut off to the long-term care component for several weeks now, and we have moved over 2 weeks ago, looking at making sure we have separation from the tenant population. These are individuals in our affordable retirement living program who live independently. They receive home care and they rely on their families and the community like any other Nova Scotian. We needed to make sure that they have the ability to access the resources they need, grocery shopping, while at the same time protecting our long-term care facility from that additional public exposure. So we've taken precautions to make sure that that is a separated population.
Okay. So I have another question from Jennifer Henderson at the Examiner. Have you been able to separate COVID positive residents from negative residents so they're not sharing a room? So they're not, yeah.
Because of capacity and because of the virus itself, what we're seeing is that if a resident is positive in a room, within a couple of days, the roommate becomes positive. So we did start out, we had our COVID unit, we had it all prepared with 20 beds. We also had almost like an epicenter on one floor. And so we started moving those residents to the COVID unit for treatment. And within 3 days, we've seen it blossom. So it would spread from roommate to roommate, et cetera. So we were up to almost 19 people. So what we did was we created private rooms on that floor and kept people stationary there. We're reviewing everything right now because what we're seeing is that that's what's happening with the virus. It's because there's a 14-day incubation period. So people can have the virus and they can have symptoms on day 2 or they can have symptoms on day 12. So what we were seeing is that if you move the roommate out within a few days, they would be positive too. So we are swabbing, and that's why today when we go through the whole building and swab again, doesn't mean that because they're negative that they're not incubating the virus, but we're going to relook at it now that we're building some capacity because we're moving people to the recovery area. We'll have about 10 beds, and now we have the QE2 staff from 8.4, which we are extremely grateful for. And they're going to be looking after the COVID unit. So we're going to start moving some residents that need more treatment there. So it's giving us a little bit of breathing room to start moving people around. So we'll be doing that.
So I have a question from Elizabeth McMillan at the CBC. So hearing about from staff about a dire staffing shortage last week, at what point did you ask for help and why didn't it happen earlier?
We have been working with Nova Scotia Health Authority and Department of Health for a couple of weeks now, keeping them apprised of everything that was happening. We were able to maintain a critical staffing complement within our building, and then as of Friday, the escalation. We hadn't seen the escalation in the beginning, and then the escalation, we've noticed symptomatic residents and did the swabs, et cetera, and then the staff are afraid. We had to put staff off when we did swabbing. That's changed now so that if you're not symptomatic, you can come to work. So there's been a lot of variables and a lot of changes in process as we've gone along. But on Friday, when we've seen so many cases, we jumped from 50s into the where we're at now with the cases. So that's why we reached out and said, listen, we just can't sustain this, so we need help. And they did come to our aid. Like I said, we have 8.4, and we have numerous people from across the province almost calling us. Even the unions have said they've put out a call for us. So there's lots of people in this, but there's lots of people scared too.
When we indicated to folks that we were overwhelmed, and we'll be truthfully honest, as Josie said, we were managing up until Friday, and when we made the call, the support was we spent the entire weekend with those supports organizing and looking at how we delegate responsibility and all those things. So we're absolutely so thankful for those folks who have risen to the challenge and helped us in this effort.
Today, when we come in this morning, we have 4 staff on every floor, and we have registered staff, plus we have a team of OT, PT, et cetera, that are supporting them to make sure that the residents are hydrated and they have some social interaction, et cetera. So it's been a good day so far this morning, plus, like I say, the 8.4 team looking after our COVID unit on 10 or on 11 and our one-on-one center has been such a relief. And having a swabbing team from the hospital come in, amazing. It's just taken some of that pressure off, and now our staff can focus on our residents.
And the team that Josie's referring to, the 8.4 team, are Nova Scotia Health Authority employees, so they've been completely deployed to help us. They're bringing expertise and knowledge and resiliency that we're so thankful for.
Great. So question from Paul Withers at CBC. He is asking how many tests are being done daily.
Well, I can tell you so far that we've tested over 350 residents, and we've tested over 400 and some staff. So today there'll be another 100 and some residents tested, and we're just working on every staff member, even if you haven't had contact, etc., will be tested over the next week, and every resident will be retested over the next week with these swabbing teams that we have. So we've been able to keep up with that and getting our results within 24 hours. But with this last increase, that's become overwhelming. So Nova Scotia Health Authority has provided us with 2 people that are coming in and just going from floor to floor and doing the swabs.
Okay, yeah, and Alicia from Global, a bit of a follow-up on that. How often are residents being tested?
So basically what we're doing and what we're seeing is that if you find somebody that has symptoms, you take the swab, you swab their roommate. You need to wait a day or so to see if they're going to become symptomatic, because if you swab them then they'll be negative, in 2 days they'll be positive. So that's kind of the rationale we've been following. But right now, working with the medical officer of health, they want everyone swabbed, whether they're positive, negative, or they're on a floor that's got no one. They want to see if it is a symptomatic spread that's causing it. So that's happening this week.
Okay. So another one from Jennifer Henderson at the Examiner. Are there ventilators on site in the COVID unit?
No, we wouldn't have ventilators, but we have oxygen concentrators, and we're seeing that the oxygen concentrators really support a resident when they're, try not to be technical, but when their oxygen sats go down, the oxygen concentrators are giving them that boost that they need to increase their oxygen intake. We also are providing some sub-Q IV fluids if they need it, and those are all comfort measures and treatment measures trying to get them over the initial infection.
Okay. So I had another one from Elizabeth McMillan at CBC. Are any residents in double rooms right now?
Oh, absolutely, because our building had double rooms. Every floor in the center has 8 double rooms, and it actually has 1 triple room. So that's why moving these people out that are recovering, it will give us capacity to start moving people and making sure that but doing as much as we can to put them in private rooms.
We had managed in our COVID-19 units for the 43 beds that we have that are dedicated to this, that they were all private rooms.
Okay. And she just had a little clarification. Can you tell us what 8.14 means?
Oh, sorry, 8.4 is the unit in the hospital that the staff are redeployed from.
Okay. So another one from Alicia Draus at Global. Are social distancing rules being enforced in communal areas, lobbies, and outdoor smoking areas and elevators? She's hearing about concerns and that people are congregating in groups of this nature.
Some of what we've done is we've taken all our staff inside and they're smoking on our deck. In general, they're social distancing, but everybody has a mask on now. So when they're doing care and they're on the floors, it's impossible to social distance if you're going to be able to provide care, etc. They do have a break area outside, but they are separating outside. Our elevators, there's a maximum of 3 on the elevator at any one time. When you walk in our building, that's where the assessment or screening site is, and they're all X'd off so that people are social distancing. Sometimes it's impossible when you're trying to work with the nursing team and work in their nursing office that they're passing each other, but they all have their masks on, and that's made a huge difference.
Another one from Elizabeth McMillan, just wondering how quickly are you getting test results?
24 hours. And it can be even earlier than that. And one of our nurse managers is connected with the CDC or public health nurses. So they actually get them, as soon as they get them, we sit down and we update our information. So the information that you get is about 24 hours old from swabbing, but it's the most recent information that we have. What we have seen is people, like staff, that go out to the outside clinics and they test negative. It can take 3 to 4 days to get the results, where if we get the results, we have them in 24 hours.
Paul Legier from French CBC, he's asking, the outbreaks in Quebec long-term care facilities have highlighted questions around subpar care and staffing issues in facilities. Has this been an issue with your facility, and could have this been a contribution to the outbreaks here?
Not thinking that's the contribution to the outbreaks, but what we're seeing over the weekend, when we did have significant shortages of staff, we're able to maintain a couple of people on every floor. So meals may have been slower in that, but what we're seeing is if we can continue the staffing levels as of today with 4, etc., our residents are still their personal hygiene needs are being met. They may not get a shower, but their personal hygiene needs are being met. And that allied health team is really responding to the need for food, nutrition, and hydration. Their best chance is to make sure that if they're hydrated and looked after every day, that they will be able to make it through. And like, we've had a 98-year-old elderly woman who made it through, and that's part of the reason. So with the reinforcements this weekend and coming in today, we've actually had a time to actually refocus and start looking at where we're at and start again.
I'll just add to that we have been asking our staff in screening protocols where they were mandated. So our concern, of course, is how it was introduced, and we understand that given what we're learning about this virus, it was introduced through individuals who were either asymptomatic or minimal symptoms, and at the time, the understanding about the asymptomatic transmission was minimal. So that's something we've learned, and as previously discussed, our staff who have brought this into the building inadvertently are absolutely devastated by this.
Okay. And I think Paul Withers, I think that answers his question. He was asking, has asymptomatic spread been confirmed? But I think we've covered that. Okay, another one from Elizabeth McMillan at CBC. How many or what percentage of residents are in double rooms?
Okay, on any given floor, so I'll give you an example. On a 33-bed floor, 16 would be in a double room and 14 would be in a private room. And then there's a triple room, and those are the ones we're concentrating on right now, getting those triple rooms separated. In the manor, there would be, again, mostly probably about, if you had a 26-bed floor, there would be 16 people sharing, and 10 would have a private room. Now, we do have floors that are exclusively private rooms. So we have 5, 6, 8, 9, and 10 and 11 are all private rooms.
Okay, and she had a follow-up. How many people are off-site?
Right now, we took our first resident yesterday, and we have 2 more going today. And it's by the time, from the first time they have symptoms, we have to wait for at least 10 to 14 days before we can declare them into any kind of recovery. And then we have to work with medical officer of health and our medical director for their opinion on whether they can transfer. So that will be 3, and we should have more by Friday because they're still asymptomatic and doing well. So the reason to get them out of the facility is we just want to make sure that they're safe and that if they have an immunity to the disease, plus it makes us have more capacity to move people around.
Just had another question from Alicia Draus about the designated person who's allowed to drop off items for those renting. Just wondering about the risks there from people entering the building and possibly bringing in the virus. Any comments around that?
Again, they go through the same screening process, so their temperature's taken, they're asked the questions if they have any symptoms, etc., and they're physically asked because we have guards on the door. And security guards on the door, and they're disinfecting their phones, etc., and we're watching what they're taking in. There is a separate elevator altogether that goes to the tenants, and up on the floors, there's a physical barrier between residents and tenants. So the only place they can go is into the tenant area.
Okay, and Elizabeth from CBC, she's wondering, have you considered moving out people who have not tested positive at this point? Why isn't this being done?
So why we haven't considered that, because you can be negative today and you can be incubating the virus anywhere up to that next 14 days. So you wouldn't be assured that you're actually moving somebody out that is negative.
Okay. Samantha from All Nova Scotia, she is asking how many residents Northwood has in total, and are you the largest facility in Halifax?
Yes, absolutely. We're the largest, and we have 485 resident capacity. I'll be getting my census actually later today, so we do a census, so then we'll know how many vacancies we have, but 485 is the capacity for the facility.
She did have a follow-up question. Quebec has asked the federal government for military help in their nursing homes because they're so short-staffed. Is Northwood considering asking the province for this kind of help?
If we can continue to keep the staffing levels that we have today, that won't be necessary. But we'd never say never if we can't maintain these staffing levels. But we have people coming. We started a pandemic relief team, so we were hiring people that were laid off from their jobs throughout, and we've had really good response from that. Up to last week, we had 50 people there that had applied for those pandemic relief teams, and they could be anything from janitorial to dietary to long-term care aides. So we did get a good response. We are bringing them in now, and now with all this help that come over the weekend, like I say, today we're in good shape. So we'll monitor that, and if we have to ask for more, we will ask for more to make sure the residents are safe.
Very good. That was the last question that I had on the list, but I think everyone had a chance to ask. So, and that brings us to about time. Want to thank you both for your time today, and to all media and of all of our participants. We will be posting regular updates on the Northwood website, so would encourage you to go. It's nwood.ns.ca/information updates. So that will be happening daily. So would encourage you to check on the information that's being shared there. But thank you all, and we'll see you again.